This hasn't happened to me at a conference in a long time, and it was great. While I was attending the ON26 conference hosted by Digital Health Canada, big news dropped elsewhere and became the talk of the conference. And when I say big news, I really mean big, like potential to change the game for primary care doctors in the province of Ontario big. But reaction isn't universally positive. I've got thoughts on it and the conference overall. Let's get to it. The ON26 conference is a great opportunity to hear from various parts of the Canadian digital health ecosystem, especially around interoperability projects, data sharing, and healthcare research. This year's event promised more of the same, and I have to say, it delivered. Kicking off the conference was a great session that featured Matthew Anderson. He's the CEO of Ontario Health, a Crown agency funded by the Government of Ontario. Their mandate is to bring together the different parts of the Ontario healthcare ecosystem. And Anderson showed off the latest version of the Ontario Health Provincial Data Utility. You can see it here in the center of this diagram. It's meant to be the place where all EHR assets sit. But rather than trying to bring all that data into a single repository, Anderson is proposing a federated approach, which means that the data would remain where it sits, but it would be accessible in a standard way to the analytic hub. Organizations can connect to this hub and gain access to that data. I really like this plan and this vision. It sidesteps one of the biggest challenges in healthcare, and that is getting data physically into a single spot. Their plan removes that from the equation, and now all we have to focus on is making that data interoperable and standardized. That's no small task, but it's better than having the additional challenge of having to move that data around at the same time. Now, I know some of you watching this will be skeptical. I certainly was when I first saw this, but it's actually happening. Meditech and other companies like that have started to make data available in this manner, in this federated approach. So I take those small wins as a sign that this is actually working. And what's giving this initiative a boost is AI. You see, in the past, this type of data initiative was mostly powered on the promise of reducing healthcare costs with a single longitudinal record, helping to eliminate duplicate tests and cutting down wait for patients. But now with AI, there's an additional and very compelling reason. All that data can help train AI engines better. And in turn, that data can help AI optimize the healthcare system in Ontario a lot quicker. I really hope this gains more traction in the months ahead. But an hour after this presentation, a big announcement was made. As part of the Ontario government's Primary Care Action Plan, which is a plan aimed at connecting everyone in the province of Ontario to a primary care doctor, well, this announcement hit that there was a massive funding increase to $3.4 billion. That's right, billion with a B. And part of that funding increase will go to a proposed province-wide primary care medical record that will, quote, be an interoperable, secure system accessible from across the province of Ontario that will provide clinicians with a more complete view of a patient's health history, improving coordination across the health system while reducing delays caused by missing records. Now, if you closed your eyes listening to that, you could be forgiven if you thought it was 2005. Look, I'm all for increased funding for primary care. We certainly need it in Ontario and across the country. But the part I can't really understand is why so many bureaucrats are obsessed with one system to rule them all. That has never worked in any industry, and I don't know why everyone believes it may work in healthcare. Healthcare is not an exception, right? Now, I'm going to reserve judgment until I learn more about the details because this announcement was pretty light on the details. But if this is a single system approach, I'm going to be profoundly disappointed. Because the goal is to make health data more portable and shareable. That's a noble goal. Solving it by trying to force all primary care into a single system is like saying the only solution to congestion is to have everyone buy a government-manufactured SUV. It's ridiculous to think that a single anything can satisfy all the needs of all the different diverse parts of this primary care group. Oh, and we did try this a little while ago. We tried this single EMR approach in the province in 2002, and after 7 years and over $1 billion of wasted taxpayer money, we had nothing to show for it. I really hope history doesn't repeat itself this time. And in my opinion, primary care is much more than just family docs. We know that dental health contributes to overall health. The same thing goes for mental health, wellness programs, dietary consulting, physical therapists, chiropractors, podiatrists. All of them contribute to the health outside of hospitals. And do you know what else all these folks have in common? They were left out of the last round of EMR funding that the government came out with. Are they going to be included this time? Because it kind of sounds like they aren't, which means that we're still going to end up having an incomplete health record for every person in the province. And if, on the other hand, if they are included, I have serious doubts that a single system can handle all these different types of specialties. I mean, can you imagine seeing your dentist use the same system as your family doctor? I can't, because for one, in the province of Ontario, one is a for-profit entity and the other has only to deal with a single payer. Now, I know I'm sounding negative, but I'm very concerned about us falling into the same pit that we fell into in 2002. A single longitudinal record, to me, is like the mythical jackalope. We'd all love to see one, but in reality, it's just really a figment of our imagination. Let's ground ourselves in reality. Let's use our governmental powers to mandate interoperability instead. Let's let the market forces determine who gets adopted and who doesn't. Let's give people choice, knowing that no matter who they choose, the data will connect because it's mandated to. Let's also incentivize sharing with dollars flowing to primary care docs for sharing that data amongst themselves. And let's fund that interoperability software that primary care docs may need to have to adopt. I'm all for that kind of thing. And in fact, I'm hoping Ontario looks no further than Alberta's Netcare EHR. Those guys in that province did not force adoption of a single EHR. Instead, Netcare is a single repository of all EHR information. It's mandatory province-wide, kind of like an HIE. And at the local level, clinics are free to choose whatever EMR they want, whether it's Accuro, TELUS Health, or many others. My fingers are crossed that that's the model they're going to choose. Now, right after this news dropped, I did try to get some of the folks at ON26 to comment on it. It was the perfect spot to be since there were so many high-level government and high-level vendor organizations in attendance. But the news was so new and fresh that everyone politely declined my request to go on record. And I really can't blame them. I do the same thing. I will say that I did get the sense from some of them that they were completely blindsided by this announcement, and that has me even more concerned. You'd think that the people in the room at Ontario ON26 would be the ones the government would consult with prior to making this kind of announcement. I hope that was the case. Now, despite the specter of this announcement looming over the conference, there were some other bright spots. The Canadian Institute for Health Information, or CIHI, held a very interesting session where they talked about moving towards real-time data access for hospitals, and then using that data to reduce wait times, as well as optimize resources. And here are Tetyana and Tanya from CIHI with more details.
Hi, I'm Tetyana. I'm a senior clinical advisor at CIHI, and I also work as an emergency physician.
Hi, I'm Tanya Khan. I'm the manager of hospital data advancement and engagement, and I'm working alongside a team at CIHI on our hospital data transformation journey.
Tanya, I have a question for you. We know all about, and some of us personally feel, the difficulties of our healthcare system in regards to ED crowding, increased complexity of patients, increased number of patients coming to the emergency department. Is there anything that you're working on at CIHI that can help us meet or change the resources that we allocate to certain parts of the healthcare system to kind of meet the demands that we're seeing right now on the ground?
Thanks, Tetyana. That's such an important question, and we know that our hospital data systems as they are today are legacy systems. So the data that we have through our hospital data assets, although rich, standardized, comparable, and trusted, They are a little bit latent in that data currency. So data is only shared to CIHI 2 to 3 months post-discharge. So we've embarked on a hospital data transformation journey to really be able to tap into data that's a lot more timely and richer so we can answer these important questions around real-time insights.
So what does that mean? So if right now it's kind of quarterly insights that CIHI is producing, like what are you trying to aim for? Like how frequent would the data be?
So we're aiming for a future system, and that is coming out on March 31st, 2028, where we can tap into a lot more near real-time data. So this is data that is when the patient is still in hospital. And we want to leverage the near real-time data flows that already exist and really find ways to make data collection and data transfer and sharing a lot more efficient.
And what will that mean for people like me on the ground? Does that mean I have to do more clicks or I have to kind of document in a different way?
Not at all. So we actually want to take away that data collection burden from the front lines. At CIHI, we're building our future system that's a lot more flexible, adaptable, and able to meet data providers where they're at.
I love that you say that, because I don't want more clicks on on my shift for sure. Thank you. That's so cool. Thanks for sharing that. So thank you so much. That was such an awesome answer, and I'm glad to hear it's not going to impact my on the ground work, especially at 4 a.m. when I'm kind of tired. Where can people learn more about this?
Yeah, so to learn more about CIHI's Hospital Data Transformation Initiative, you can go on CIHI's website. So that's www.cihi.ca and look up Hospital Data Transformation. But you can also contact us at hdt@cihi.ca.
CIHI is also collaborating with other countries like the US and Australia to drive data sharing and digital transformation. I caught up with Shannon from CIHI to learn more about those initiatives. Well, Shannon, welcome to the program.
Thank you so much. I am so happy to be here.
I'm excited to have you on the program. The last time we were together, I didn't get a chance to interview with you. I interviewed with your colleague, Christine, instead. But I really enjoyed the session that you just presented here at the Digital Health Canada event, where you talked about some of the interesting things that CIHI is doing internationally. Can you share a little bit more about that?
Absolutely. So as part of our Connected Care strategic initiative, we're working really closely with countries like the United States and Australia to establish a core data for interoperability. So in Canada, this is the Canadian Core Data for Interoperability, or CA-CDI. But I think what's really cool and sort of the unique advantage that we have is that other countries have come before us. So we don't need to reinvent the wheel. The US has their US CDI, Australia has their Australian Clinical Data for Interoperability, and we're really able to sort of work collaboratively with both of those countries on unique challenges that we're facing within our countries that are also shared with other countries as well.
So is the goal here that, you know, when achieved, that dream you spoke about during the present, is that if I happen to go to a care facility in Vancouver and I'm normally based here in Toronto, that the record or what happened over in Vancouver could be accessible to the people in Toronto? Is that kind of the idea?
Absolutely. So I think within Canada, we're working really hard to establish common data standards that can move not only across, say, provincial and territorial borders, but also across sectors of care. So that if you are in an emergency room in one of those provinces, your family doctor has access to information about that stay and vice versa. I also think what would be very cool is if we could do the same sort of thing internationally. So we know that there are vendors who do operate transnationally, particularly within Canada and the United States. So to make the implementation process a bit easier for vendors, one of the things that we're doing is leveraging our core data for interoperability, or those common data standards, very closely after the work that's been done in the US. So then it's a little bit less of a heavier lift for those vendors.
Right, and I'll name them since you won't. Since I won't. But you know, it's the Epics, the Meditechs, the Oracle Healths of the world,
For
right?
sure.
So that way, if they're implementing down in the US and they're implementing here, obviously they have a presence here in Canada, the standards are similar enough where they don't have to do, as you said, a heavy lift to get it to work in both countries.
Exactly. And I remember when we first started talking about this a few years ago, I asked a representative from one of those vendors, you know, what would it take for you to implement the Canadian Core Data for Interoperability? And they were like, well, if it's similar to the United States Core Data for Interoperability, not much, because we've already built sort of to that system. The key difference is the terminology. So we're working hard to ensure that the vendors can implement the Canadian versions of the terminology, but otherwise there's a lot of synergy.
Now, I have to ask you this question. And when you look at all the developments that are happening in the Canadian context, is there anything that gets you really excited about what we're doing in this country around digital health or around standards, anything like that?
Yeah, there's a lot of things that get me very excited, but I think the biggest one has really just been the collaboration. So we are very intentionally co-designing these standards with partners and stakeholders from across the healthcare system. So with clinicians, with patients, with vendors, with Indigenous individuals and communities. And it's been really cool to watch those different groups sort of come together. So we have our data architecture co-contributor group where we have vendors who would traditionally be competitive with each other, having conversations and sharing information and really sort of working together towards this common goal of interoperability. So that's been very exciting. We also recently tested the CA-CDI at the Pan Canadian Projectathon. So we had four vendors voluntarily sort of sign up to test the specifications. So it was very neat to see sort of the CA-CDI, which has been this vision and this dream, actually turn into a reality and to see kind of the messages moving back and forth. So I think that's really exciting too.
So Shannon, tell me a little bit more about the implications of Bill S5.
Yeah, so Bill S5, or the Connected Care for Canadians Act, is sort of the rejuvenation of what was formerly Bill C-72. So Health Canada has reintroduced the bill in the Senate. It's making its way through the legislative process. But at its heart, it will really do two things. So it will prohibit information blocking, and it will also require vendors to adhere to a common set of standards. Both pieces fundamentally important, but I'm really excited about that second piece. And I think that it has the opportunity and the potential to really be a game changer for digital health in Canada.
What do you think it will mean in terms of if it's implemented right, if it's enforced correctly, what will it mean for Canadians and for healthcare providers down the road?
Yeah, so it should mean that your health information will move with you. So digital health vendors will be required to sort of adhere to a certain set of standards that will mean that if your family doctor is collecting a certain set of information about you, it can travel with you and it can mean the same thing between systems. And then I also hope what it ultimately leads to is that you as a patient will have access to your healthcare information in a standardized format.
Well, Shannon, where can people go to learn more about CIHI and the initiatives that you're working on?
Absolutely. So CIHI.ca/connectedcare is the best place to go. You can also email us, connectedcare@CIHI.ca, or find me on LinkedIn.
Overall, I really enjoyed being at ON26. Shout out to friends I managed to catch up with from Ontario MD, Meditech, CIHI, Digital Health Canada, Identos, LK, Ernst EY, Deloitte, and so many others. It was great to hear all about the exciting projects that everyone's working on to improve Canadian healthcare, and there are a lot of projects. I can't wait to see many of you at the big eHealth conference in Halifax in June. Special kudos and thanks to the Digital Health Canada team for allowing me to be part of this conference on short notice. I appreciate the hospitality. The conference was great and everything went smoothly. And if you made it this far in the video, we would really appreciate it if you mash that like button and click subscribe. Also, head on over to healthcareittoday.com where you can find more great content like this. I'm Colin Hung. Thanks for watching, and I'll catch you on the next video.